Osteochondritis dissecans of the capitellum is a painful condition of the elbow which often affects young throwing athletes. The pathology is disruption of the hyaline cartilage and underlying subchondral bone of the humeral capitellum. Epidemiology. The prevalence in Japan is reported to be 1 to 3% in adolescent baseball players. The risk factors are found to be begin to play at earlier age, longer duration of competitive play. Biomechanics. In throwing motion, from cocking to acceleration phase, violence torque and rapid extension force was generated, resulted in compression and shearing force to radiocapitellar joint. This repetitive overload resulted in cartilage and osteochondral fractures. Dr. Takahara studied pathology of OCD lesions using biopsy materials. In the very early stage, the pathology is separation of cartilage and subchondral bone. Then, calcification and fiber-cartilage connection occurs, leading to delayed ossification. Finally, osteonecrosis and separation occurs, and this fragment goes to loose body. Diagnosis. The patient presents throwing-related lateral elbow pain. They occasionally present catching, cracking, and locking. On physical examination, patients have a tenderness over the capitellum and the radial head. A restricted range of motion is often observed. Radiographic classification. There are 3 phases. In early phase, radiolucent phase here, and separating phase and defect phase is accompanied with a loose body. Radiolucent phase corresponds to International Cartilage Society classification OCD-1, and separating phase corresponds to OCD-2 and OCD-3 depending on the stability of the fragment. OCD-3 represent unstable lesion, and defect phase correspond to OCD-4. I would stress 45 degrees flexion AP view is crucial to identify OCD lesions, at the lesion located at the front portion of the capitellum. MRI is also important. High signal interface between cartilage and subchondral bone suggests unstable lesion. This is important to determine the surgical indication. A treatment algorithm. A treatment in the radiolucent phase with stable lesion and separating phase with stable lesion, conservative treatment is indicated. And separating phase with unstable lesion and defect phase are indicated operative treatment. And if conservative treatment failed, it goes to operative treatment. Operative treatment consists of osteolymphatic bone peg, arthroscopic debridement, and osteochondral autograft. If the diameter of the lesion is over 10 to 15 millimeter, osteochondral autograft is usually selected. Conservative treatment consists of discontinuing throwing and sometimes batting for at least 3 to 6 months. This X-ray and the diagnosis, the radiolucent phase At 3 months, ossification occurs at the lateral face and extended to medial face. At almost 24 months, complete healing occurs, and this boy returned to a picture. Conservative treatment is very effective in early phase. The radiolucent phase healing rate is 90%, and 80% of players return to play. But in separating phase, healing rate and rate of return to play goes down. Arthroscopic debridement. This boy first performed conservative treatment, but it failed. A lesion getting smaller, but not completely healed. Then he underwent arthroscopic debridement. The humerus, capitellum, and radial head. You can see the lesion here. The scope is switched to posterior compartment, radial head and capitellum. Remove the loose body. Debride the lesion and drilling. So you can see a good bleeding here. Osteochondral autograft is indicated for advanced OCD lesions. We have two kinds of procedures depending on donor site, one from the knee and one from the rib. This slide was provided by Dr. Imada. Osteochondral graft is harvested from the knee, either using small skin incision or under arthroscopy. Dr. Imada transferred the graft also under arthroscopy. Debride the lesion and 6 millimeter diameter of graft are introduced, and this is final graft. So this slide was provided by Professor Kazuki Sato. This is the reconstruction using costal osteochondral graft. The graft was harvested from 6 costal osteochondral junction from the rim. The graft floor and transplanted the graft here. The case presentation: pre-op radiograft, 1 year post-op, 3 years, and even in 8 years, remodeling occurs, and he reported a very excellent functional score. The operative result: 72 patients were included, and the average follow-up period was 4.8 years. Over 90% of patients reported excellent results, and almost all patients returned to their original sport. In conclusion, OCD of the humeral capitellum is a painful condition of the elbow, which often affects young throwing athletes. In early phase, conservative treatment consists of discontinuing throwing is indicated. In advanced phase, arthroscopic debridement, osteochondral autografts are indicated depending on the size of the lesion. I really miss this crowded condition, but this will be back soon. Thank you for your attention.